At DCG Analytics, we really try to focus on helping our clients make better data-driven decisions. And through this process, we find that a topic that keeps coming up for us is site selection. So understanding how to make better decisions about where to expand, either where to expand or where to like pull out, or if we're making purchases, like how to acquire something that isn't too close, or if we are close, like what makes a better decision, all that stuff. So this recording is a conversation that Scott Jones and I had. Scott is a principal consultant here at DCG Analytics. His background is in this space is extensive, really starting in telecom, which he'll talk about a little bit on this recording, and then really moving into retail and eventually medical. So we are excited to share this conversation with you. If you have any questions about it, please feel free to reach out. I'll leave all of our contact information below, and have a great day. Enjoy. All right. You mentioned that, so the other day we were talking about site selection. And I know I've seen it done in Alteryx, and I know what it is, but I did just want to chat with you on it, see kind of how you're doing it, run through it, then we can nerd out maybe a little bit, and then we'll go from there.
Yeah, absolutely. So it really starts with sort of defining what you mean by site selection, right? It's the idea of what are you really trying to get at. So different types of companies are going to look at it in different ways. And I have done it in a ton of different industries, actually. One of my first jobs using Alteryx, before I worked at Alteryx, was doing site selection, but for a telecommunications company. So we were actually building cell sites. And so when you do that, you don't just say, oh, well, there's not a cell site here, let's put it here. Mm-hmm. It's really around a lot of different information and also what the goals are. And that information is like, what is the current coverage, right? Can you make a phone call from this area right now? But you also have to look at, well, how far is it to the nearest other cell site? They call them neighbors, right? Can they connect to each other? Can they get the data from that cell site back to where it needs to go? And are there enough people there, right, to actually support that? Like, is there a need? And so if you're a fast food company, you have the same idea, right? I want to expand my market and build some new fast food store in some area. Okay. So is there a need? How much is already there? Where are our existing ones? And are we going to make enough money if we do that? Right. So you have to think about these things and sort of collect all that information to start to do that analysis before you can just say, I want to put I want to expand into this market. Okay.
Yes.
What's going on there? So think about, the first thing I say is to start with really defining what the goal is, right? Is it that expansion to a new market? Are you trying to expand in your existing market? Right? Are you getting so much business that you think you can add more without hurting your other stores and still make money? Are you looking to shift? So site selection could also be, we don't like where the business is at. Maybe we're losing our lease, or there's been an economic shift in that area and we need to relocate to another area. So that could be site selection as well. And then you also have to look at, are we going into a place for competitive advantage? Are we trying to come in and take over? You think about, are we a large brand coffee company that can come in and dominate the market over what's existing there? So what are the goals? And based on those, that's really going to define how you start to put together the analysis, right? So look at the market first, right? So now you know your goal. Now you have to start to analyze those markets, whether it's to decide which ones they are or really to narrow to where do we want to go? You're probably not just going to canvass the whole United States and then just make a decision. That's typically not the way you're going to do it. If you're a business and you're sitting like you're, in Oklahoma, say right now I'm in Oklahoma City, I want to expand my business, but you're not going to look at the whole US and say, I'm just going to pick the best place. You're probably saying, I want to expand within the Midwest, or I want to expand into the Southeast, and you're going to start to narrow that target focus for what works for your brand to go through. So you start limiting that piece. And if you have that, you start to say, okay, these are what we've defined as possible good market areas based on what we do, what we sell, what our goals are. Then you start looking at, okay, let's start finding the places that'll have enough customers that'll support us. And let's find where there's let's say it's a retail, where can you put it where people are still willing to travel to your location, right? So if you're a big box retailer, you're not going to drop your business out in the middle of the farmland, right? You want to look for where you can maximize the revenue based on that. So you might put it into the central area of a rural, if you're looking to a rural expansion, some city center that has a lot of rural that people will travel, because if you're in a rural area, you're more likely to travel longer distances. So you start analyzing how far will people travel. So you look for data around that. Then you have to look at, okay, let's look at competition. And when we talk about competition, there's two kinds. There is your direct competitors. So I'm a coffee company. I have to look at other coffee companies or places that sell coffee in the same way I do. But I also have to look at competitors from my own businesses. So where am I going to cannibalize business or revenue from one of my existing locations? So if I'm just concentrating, I'm expanding within my market, I look at that, how far will people drive? What is the population now and in the future? And how much revenue am I going to lose if I build one too close to my other location?
I pulled a lot of things from. I'm sorry, I'm writing this down because you've got a lot here. And it's starting other questions. Let me just kind of recap what I've heard, and then I'm going to go into like a specific question. Essentially, it seems like there's three things we can do with site selection. Where do we go in / where's there a need, or is there a need in an area? How do we make sure we aren't competing with ourselves? So if we already are, let's say we're in a town, but we want to be more in a town, how do we make sure we're not too close or we're not cannibalizing that other business? Or probably a more realistic example, back to your coffee shop thing, is if a coffee shop buys another coffee shop and now there are too many in a space, how do we know which ones we need to pull out? And then how do we move if things have changed, or it's not, like, when do we make a decision based on shifting demographics rather than maybe that's not the right way to put that, but like, how do we decide? It is.
Yeah.
Okay.
Yeah. So I think when you think about it in different demographics and shifting, right, your business might cater to a specific group or specific type of person, right? So when you think of behavioral analysis and demographic analysis of, these are the people that currently are our main revenue generators, this is what they look like, a picture of them. If we're sitting in the middle of an area that is shifting, right? And so we're not seeing that group of people necessarily anymore. We might have to rethink our business and what we're marketing to, or we need to rethink our location. So when you think about the dollar stores type of business, right? They may have been in an area that appealed to a lower income group, because that's their target sales group. Now, if there's been a reinvigoration effort in that neighborhood and all of a sudden it's a more affluent, demographics in that area, well, those people might not be as inclined to shop at a dollar store. They want something a little more, maybe it's something that it's the young up and coming generation that wants more of a local brand, rather than a national brand that they prefer to sell. And you're going to lose revenue as these things grow around you, and people are going to go to the competitor. So you're going to have to say, okay, this location isn't working for us. We'll either shut this down or we'll shut it down and look for somewhere that does fit that. And maybe there's an opposite area where it's a new development that is focused more on first-time buyer families that have a lower income, and a dollar store will be really helpful for them. Yeah. So you might target that as a better
end. How do we? I guess if this is an analysis you do. Wait, how do I want to say this? It seems like we could decide to take a look at an analysis like this based on like lost revenue, or close a store because we're not making the same amount of revenue as we were, or we're not making enough to stay afloat. Is this analysis does it help you get ahead of these situations where you can exit a store before you get to that point? Or is it like why are we losing revenue in this new affluent area sort of question? I guess what I'm trying to figure out is what's the best use of some results like that? Because it always seems like loss in revenue is like the driver of okay, we close a store.
Yeah. So I think you're on track with a lot of it. So revenue is obviously the biggest driver in any business that's trying to make money. Now, there's other businesses that'll look at it from different, vantage points, but for the most part, it's around revenue generation.
Uh-huh.
This is where it comes back to that first point: is what is your goal, right? And really defining what the goal is to do the analysis. Is it we want to expand and increase revenue and our footprint and our market somewhere else, right? So we've done really well here. We want to do well somewhere else, right? So that's expanding to a new market. There's expanding within your market. We're doing really well here. We have more business than we can handle. We should open up new stores because we think it'll generate more revenue. Then there is, we're not doing well here. We've done analysis. Our revenue is falling. We don't think we can sustain in this area, but we still think we have a good business. Let's look for the right place to put the business. And then there's that competitive advantage where you want to not only expand into a new market, we want to take over a market, right? And so and that would be where you're looking for competitors that you can overtake rather than do work in, live together happily, right? So I think of those as sort of the four thought processes. Now, the why you do it, there's different things. That's what leads to the goal. It could be, like you said, we're not making revenue here. We need to look for somewhere else, or we just need to increase the value of our business for our investors. So we're going to expand, and we feel that we can support expansion to other places because we've been successful here. So looking at those two different pieces.
Okay.
You mentioned about it. Can it help you decide these factors? Well, yeah, that's what analysis is for, right? So you might have this goal, this idea. Doing the analysis could lead you to these are the places. But like with all analysis, it could also lead you down the path of this is not the right idea for right now.
Yeah.
And that's why when you look at things like demographics, population, traffic flows, the different types of things that you might look at, new construction in an area where buildings are coming up, you look at that data, it might actually point you to, hey, you may want to expand to this area, but this is not a good idea. Maybe you need to rethink, or maybe your business just isn't going to support some of this expansion right now. So you do have to look at that.
Man, I'm just trying to.
It's
my
not
head's going in like a
process.
No.
Yeah.
It's how do we gather that data? There's a lot of questions around that, but I guess I want to revisit another point that you had brought up earlier, where you talked about let's say we move regionally, how do we understand, like demographically, the Midwest and let's say I don't know, Oklahoma isn't really the Midwest. Southwest, let's say Midwest and Southwest have similar demographics. Um, what's like, how do we, this is probably all just like one part of the puzzle, right? Like it's not like, oh, demographic like for like doesn't mean exact sales, like, or like success. What else do we think of other than like demographics when trying to move into a new market?
Yeah, there's a lot of things you look at. It is again based on what you're looking for. So going back to my first sort of example of building cell towers out, right?
Mm-hmm.
For that, the data we used was we did use demographics for sure,
Yeah.
and we were also looking at what is the population. So that's what is the potential market in 5 years and in 10 years. That was really important. Is there enough? But we also looked at, so I had people that would get in trucks with a bunch of cell phones connected to computers, and they would drive every single paved road and collect what the signal strength was. So how good were calls there? And we'd identify problematic areas, right? So think about that as an area that's underserved. And then we would bring in
the old "Can you hear me now" commercials.
exactly. My friends used to call me the "Can you hear me now" guy.
Can you hear me now? Good.
And then we'd look for, okay, let's look at our existing sites. How much of those existing sites could meet the demand that could be there? Could we tweak them, right? Because you can adjust sites, you can change their angles, things like that, to cover those areas that need help. Then you look at capacity. So they can only handle so much. So when you think of capacity, think of it like think of your coffee shop with capacity. How many people can you fit in that shop at any one time? That's your capacity. That's how much you can sell. You can't sell more coffees than you can accommodate people coming into the store, right? Mm-hmm. So capacity. We would also look at some other really important factors like people that had called in with complaints. So we look at tickets. People say, I'm dropping calls here. We look at drop call data. We look at new developments. So we look at construction plans. Where are they building out stores and businesses and housing? Because that's new target areas to make sure. We look at environmental, right? There's regulatory. Where can you actually do this? You can't just go drop your new business in the middle of a marshland in Florida. They don't like that, right? Yeah. So you have to have considerations around the environment and what you're doing. Mm-hmm. There are regulatory rules about how much you can have, how much you own. Can you get supply to that area, right? So all these different factors that you think, and that's just for a cell tower. So I typically started with about between 13 and 20 inputs of data to do this analysis. And I would output several maps, data, recommendations, so on. And that's pretty common, right? And those all sort of, I think, transfer over. So if I'm a retail business, I have to look at where are their people, how far will they travel, who's there, what's existing. You might think about, am I a business that needs to be seen from the road? If I'm a storage company, I probably want people to see my sign, but it's not critical that I'm on a main highway necessarily. Mm-hmm. If I am a convenience store that sells gas, I better be really close to a road, on the right side of that road where there's a lot of traffic.
Yeah.
So you're going to want to pull in traffic data. And you can go to the city government, things like that. They may have done traffic studies before they did buildings, but most companies are probably going to go buy that as third-party data that's available. So these are where you start to get this information to build up. Okay, this looks like a good area. Maybe I've done it to the zip code. Maybe I've done it to a block or a block group or a metro, whatever size you looked at. But now you actually have to pick a specific location on a street that people are going to drive by and say, I need gas.
Is this something it seems like there's both an analytic component to this and like a physical going and looking at a site component to this? I imagine probably it's different steps, like where, analytics help get us in the right space, and then we have to get very specific when it's like, where exactly do we want to go? Let me ask you, in let's say a coffee shop example, if it's like, okay, we decide that we want to set up here, is that like, you get 1 square mile where we want to shop here, we suggest kind of these areas to look at? Or is it like how have you approached it? Or let's go back to your cell tower services. Are you like, here's the exact spot in the world where I need to set this up, or it generally needs to go here? Like, what's that look like?
Now, in the case of cell sites, that would usually require somebody go out and physically look at the area to make sure that it can support a tower. But then there's also they have to get with the government, make sure that it's zoned correctly, or if that zoning can change, what's the general perception locally. So they'll actually have people go to city council meetings, talk to the local people, and make sure, because people push back on stuff like that often. But let's say you're let's say you're a sandwich shop, and I've done this for a sandwich shop, so I'm going to use this example. Mm-hmm. One of the things that they used to decide was not only a general location, so maybe just they got it down to, within a quarter mile somewhere in this area we're looking. But then they would also bring in, and one of those things that you have to make decisions about, which was, are we going to build a new sandwich shop? Are we going to buy or lease an existing building that's available? Now that starts into the real cost analysis that you have to think about, right? What's it going to cost us to do this? Building, obviously a new building, it's a lot of costs. You might run into regulatory, zoning, construction, supply, all of that. But if there's spaces that meet your needs, that might direct you more. So now you're targeting, okay, this is the area we're going to look at. Let's look at all the real estate that's available in those areas. Let's plug in square foot, what they have available for electrical outlets and all these different things. Is it in a strip mall that would draw more people? Like, where is this? If I'm opening a sandwich shop, is there another sandwich shop in that strip mall? Is there a grocery store, or is it a clothing store? So different things that would say these people are more likely to go. Maybe you find a great location and it's in a movie theater strip mall, right? That might be a higher visibility and higher desirability because you have people coming in and out of the movies that want to grab a sandwich. So you have to look at those different pieces and then come up with almost a ranking system. Does it meet the different checkboxes or percentages? So you do some quantitative analysis around that. It might be even the level of market basket or Monte Carlo for optimization of that different piece to score your different locations as you go through. And something like an Alteryx can do all of that for you, right? Which is kind of nice to be able to bring that in, which is what I've used in the past. And then whatever mapping programs and different data programs you want to use to report on that.
It's interesting to think that, like, you were talking about competition in a space, but sometimes like the competition is good. For example, car dealerships. Why are there a bunch of car dealerships all in the same spot? Well, it's like, okay, it drives by driving people to others. It also drives people to you. So there's certain industries face that. It just seems like each of these analyses requires like separate macro questions and then micro questions.
And with a car dealership, the reason they group them together typically is, I think there's a couple reasons. One is not everybody knows what kind of car they want, and it gives you just an amazing amount of marketing by throwing your newest car out right next to where somebody else's newest car is sitting there.
Yeah.
So it makes it easy for the consumer to jump from one and make quick decisions. Also, car dealerships require a lot of square footage for land.
Yeah.
And typically when they go in by putting in there's a lot of land right there. It makes it easier for them to go in. And then the other piece is often you'll see those car dealerships can have the same owners.
Yeah, right. That makes sense too.
So there's a lot of different marketing decision making around around doing that. But you'll also tend to notice, and not always the case, because you have those huge car centers. When I lived in Arizona, Gilbert has one that it just seems to go on forever. But you'll often see that the Ferrari, Audi, and Mercedes dealers are closer together, and then the GM, Chevy, Ford, and Dodge dealerships are closer together because they are
similar
thinking
products.
about demographics, right?
Interesting. Let me ask you. We've talked about retail, we've talked about telecom, but how can we do site selection analysis around other industries? I'm trying to think of like medical maybe, or I don't know. I'll have to think about some other industries.
Healthcare is certainly one that is important, right? So now healthcare will look at it maybe with even another lens when they go through it. And so often, though, the terms are what changes. It's the same idea. Often the terms change, but when you think about a healthcare facility, they are still businesses. They may be nonprofit, but they still have to generate a revenue for that nonprofit to do research and things like that. So where they're going to look for, they don't necessarily look at it as competition and different pieces like that. They're looking for underserved markets is a good terminology for that.
Okay.
So I recently built one actually that was, let's look for where a hospital system should build urgent care clinics based on where there is a need, right? So it's an underserved area. So in that case, you start to have to look at, okay, well, where are current urgent care clinics? Then let's look at how many people are around there. And again, how far can they travel to make it? Because when you think about rural areas, there's not hospitals all over the place. And they rely on urgent cares to be able to do a lot of this. And then instead of looking at you have a different look. You still do demographics because there's a higher level of, when you look at demographics, the people that use urgent care, when you look at the majority of them, they're going to be your youngest people and your oldest people. And then people in the area that fall into certain health risk categories. Now there's data out there about all of this. It's pretty easy to get, where you know how old people are, you know how, if there's healthcare, because we fill out surveys, and the United States Census actually reports on a lot of this stuff and makes it readily available. And then the hospitals themselves, they're going to have their own customer information. And I say customer, it's actually patient information, right? They know what diagnoses have been given, and they might have people that are traveling a long way, and maybe it's where we can offer something more in that area, still keep it busy, even if it's rotating doctors and things like that, where you do analysis, to be able to provide healthcare in rural areas while still funding enough to keep that hospital running. Because if they don't have enough patients coming in, they're not going to generate enough from the insurance companies paying back to actually keep it afloat. They still have to pay the doctors and the staff and pay the rent. So those different things apply.
Okay, that all makes sense. Now, I just can we look at an example of this? Because I think that we've talked a lot about the theory and the things we need to talk about, but I want to see something we can hold, put in our hands, if you will, or I want to see. I imagine the output of all of these are a lot different too. That's one of the other things I've been trying to sift through in our conversation is what does an output look like? Here's a report. Is it something that we create? Okay. All right, cool.
Yeah. So when you think about it again goes back to the number one thing I push, which is the output is going to be dependent upon the goal. So what your goals are is what you need to do analysis to answer. Can we do this? Can we expand into a new or existing market? Can we move to another location, and then information about all the different, you want information about all the different possibilities so you can make an educated decision. That's analytics, right? So in this one, we've used Alteryx. We're bringing in quite a few pieces of information. Okay. So some of that census data I mentioned, we're bringing in existing locations. We're going to bring in our own patient diagnosis information that's been anonymized. But we're trying to say where would be a target area to look at to build an urgent care. And so in our analysis, I used Minnesota for a couple of reasons. One, I live in Minnesota. Mm-hmm. Also, they had a great repository of data at their health department that I was able to get all of the medical locations in the state. Okay. So all the licensed ones. So I looked at this in a couple ways. So one, after bringing together all my data, I did some scoring analysis. So I looked at some scoring to sort of rank the likelihood that this would be a good location. And that's going to be based on some of those things I mentioned: age factors, general health, distance to how far people would most likely, need to drive in that area, where there's existing hospitals, and so on. Mm-hmm. And I broke it out into where there's possible competitors. So with this one, we can see, and this is by zip code, so pretty large areas, but being in urgent care, I want to look at that. And so we can see different clusters, and you'll notice there's nothing around like the big cities here. They're all going to be down in the rural areas that we're looking at. Let's give that a second.
I'm sorry, can you show me what is this, what we see? Where there's a lot of competition?
Yeah, so these are rural areas, so sparsely populated. A lot of it's farmland. There's cities, for sure, but we're seeing where the green dots are, where there's existing locations.
Oh, okay.
And what I've done is, based on our scoring, I'm identifying zip codes that are possible areas to expand that already have some competition. And again, that's just sort of based a lot on what the population that meets our criteria is. Just because there's competition doesn't mean you shouldn't go there. There might be room for two. There might be need for two. So that's part of that analysis. And so you can see I have things like, is this an aging population? Is it a young population? Does it meet our general health guidelines? Target zip codes, and eventually we get a score for each of these. So if I choose this,
is that score an arbitrary thing that you created, or is that like
I created my own quantitative analysis around that based on what the goals were and the different criteria they need to meet. So every company is going to be a little different. So we can see we have different measures that we're looking at, and so by scoring based on all these different pieces of information, that's how I come up with an overall score.
And I'm sorry, this is right? General urgent care. These are urgent cares, right? Not just hospital facilities. Okay. So to note, as part of this analysis, we aren't just looking at we know specifically in the healthcare realm what the quote unquote competition is. This isn't like, oh, I just want to see where there aren't places. This is, I know I'm looking for urgent care, which is this type of patient care. If I was to do something else, like put in like a cancer center, we would do a separate complete analysis for cancer centers, right? Okay. All right.
Right. Yep. So in this case, you can see some of them they're not necessarily all called urgent care, but they offer an urgent care.
Okay. So they might do other things too.
Yeah. So we have this one I clicked on here, which is in Walnut Grove. Okay. So it's the Sanford Clinic. And so by looking at that, we know that exists. We look at the score, and based on the score and everything else we've looked at, and again, that score is something as an analyst, we look at the analysis, so quantitative analysis, to come up with how do we score this? And you're probably going to look at your existing customer base. What types of customers are coming in? What do they look like? Because you're going to look for something similar in most cases as a initial guideline, right? So as a hospital, these are the type of people that typically come into urgent care. That's probably going to be similar in a lot of the same areas you're looking at. But this is saying possible competitors, but based on the population, we think it can support two. So we have a total weighted population, in this area. We think about how busy they're going to be, how often they come in. Do they meet our criteria for enough people within a certain distance? And so being a rural area, maybe it's 50 miles that they'll drive. If it's a more dense area, maybe they'll only drive 10 miles.
Yeah.
And then we also see, we might take into account that there's several zip codes here, some with and some without. So you'll see there's like a little square here. How many people are right here? And so you can see where those coverage areas are. Then we looked at it from another angle. Let's look for where there's no urgent cares. We actually have quite a big area here. So I'm going to go ahead and pull my map up so you can see it.
And we could probably do something, sorry, just as a note for like the mapping capabilities of this, right? Like we could probably also do something where like we show these zip codes based on, when we color them based on like densities and stuff like that.
Yeah.
Yeah. Oh, like this. Okay. Sorry.
Yeah. This one I can't zoom though, which is the only. So I wanted to be able to give you, but I can. So
right,
what I've done
go back
is
to the other thing. We'll come back to this in a second.
Yeah, but it's a good where I just want to say, pardon me, I see a big cluster here.
Yeah.
Right. Oh my gosh, there is just no coverage over here. Now you need, as an analyst, I'm going to say first that's going to pop out to me, but then I'm going to go say, well, what's going on in this area that there wouldn't be? And this is why you have to put criteria. And I can see the total weighted population ends up being a 242. So this is the Iron Range. This is mostly national forests, and not a lot of people live right in these areas. So if you were to put one, you'd have to centralize it to based on how far, again, people would drive, right? So when we zoom in, you can start to see a little more. If I put this on a satellite map, you could see, quite a bit. I don't know if how quickly that will load up, but you're not going to see a lot of streets, is what I'm saying.
And I think I would say a lot of Americans pride themselves on their like how far out they are from civilization. Yeah. So like it makes sense that there's not a lot of people, but people still want to live there, and they make the decision not to live near urgent care or whatever your facility is. So okay. Yeah.
And you can see the areas where we're not targeting. There's actually there's towns in here.
And when you say not targeting, it's not part of the analysis of this.
Yeah. So this isn't an area we would suggest to expand to as a zip code. This one, and it's not even suggest. We've just identified ones that meet a certain criteria. Mm-hmm. And so these might be, but there's not a lot of people here. So you want to consider that. And so the scoring of it when we come back is, our target score ends up being a 2. And I've just done these as a 1, 2, 3 as an example. So when we look at that same area.
That's interesting about this is that like when we're talking about this, where this is very much a geospatial analysis, but there's the other things that are required for making these decisions is that like, sure, there aren't a lot of people there, but that might also reduce your costs because property's cheap or cheaper, or there are other factors where it would make sense. Your
staffing is a lot less, right? Mm-hmm. So you might not need a doctor on site all day, every day. You might be able to get away with just a PA or a nurse practitioner to handle most of your needs. Yeah. Right. Mm-hmm. And then have a doctor who's on call that comes in, once a week to make sure and check on certain things. So and a lot of the rural hospitals already do something similar to that.
That makes sense. Okay, I'm sorry I interrupted you. You were going to show us something on the location scores, no identified competition.
Yeah. So we had focused up in this area, and you can see I actually have some green. So it is saying the population and the criteria are looking good based on for this zip code. Less so in some of the forestry areas because they would probably be able to be covered by this. Then you have the red, right? So this one up here, which is basically on the water for the most part, and you actually
is that little part of Minnesota that goes above?
You have to take a boat to get up there.
Oh God, okay.
Yeah, for the most into a lot of those areas. So we're not going to build an urgent care clinic up there, for sure. But we might, along the border towns up here. So we start to look at this plus, so this map along with our detailed data information of why we got there, right? So we've done two different things, right? So these are different ways you want to analyze this. You need the data, you need the algorithms to come up with this is how we got here. So this is what the data is showing us. And here's a visual of those areas for the people that might know that area better, or be able to point and say, yes, the data points to this, but we have some internal knowledge that the data doesn't have. And that happens a lot. Yeah. There's always some internal, which is why you're not just going to say, oh, we're going to build one there, plan it, go out there and say, oh, well, there's actually nowhere to build one here. So you're going to make some decisions by actually going on site most times to make those decisions, right? If we didn't, real estate agents wouldn't exist. Yeah. You don't go, some people do, but for the most people, don't buy a house without touring it, right? Or at least seeing pictures or something without. And if you're like me and you, I'm sure, we actually analyze the neighborhood, make sure it's a good fit for us. The schools are right for our kids, that it has the grocery store we like to shop at. All these different little things that become important to us. Does it have the gym I like to use? All those different pieces of information that you can fill in here. But then there's I went and looked at that house and it had all those qualifications, but the neighborhood itself just didn't feel comfortable to me. Maybe it was a little more run down, or they weren't taking care of the park. Things like that, yeah. The data is not going to tell you, right? Why are there so many bars on the windows, but I saw the crime rate is fine?
Yeah.
So it makes sense. Keep people out, or the neighborhood used to be more dangerous, right? So, but it doesn't feel comfortable to you. Yeah. Here's a very strange example. Down the street from me, a store. When I moved in, it was great, but the store opened up and they covered all of their windows with like neon flashing lights that went around in squares around every one. And it just looks tacky. And it's the road you have to take to get back to where I live. And every time we drove by, it's just like, this is uncomfortable. And I believe we're not the only people that felt that way, because they've turned the lights off, luckily. I see. But it made the neighborhood not feel as nice as before, because it felt a little Vegas Strip, which is a fun place to visit, but not necessarily where
you want to be. Yeah.
So those are the things data can't tell you. Okay. Social media, unless you might bring in social media data, that's definitely another data source to bring in. But again, I urge you to do some serious sentiment analysis on that to try to, decipher what is true and not. Computers really struggle with lying as well as.
I'm wondering with AI,
the way we word things, right?
If there are ways to like, maybe that's another conversation we can have. Is how AI
can do radar analysis and things like that that'll score sentiment. But let's say I typed in my whatever social media feed. Yeah, you should go here. This is such a great place. What is a computer going to think versus what you might think because I put a laughing emoji at the end of it, that it doesn't know that I'm being facetious.
Oh, yeah, facetious, interesting. Well, it's funny too, because like I put so I live in Oklahoma, and a lot of people talk crap about Oklahoma, and I'm like, yeah, it's terrible here. Don't ever come, because I don't want anybody here. I live in Oklahoma because there aren't a lot of people here. So, like, there's a lot of that too. So let's real quickly, let's talk about this analysis, or let's look at the other output here, and then I want to talk about like the process of this whole thing. Like let's say you get a client that's like, Scott, I want to do some of this stuff. How do you, what's your process, and what does delivery look like, and how involved are you past that delivery? Like, is it, I assume it's a conversation where like you provided some analysis, they ask you other questions of it, you say this is what it's going to take to answer those questions, and then you do it, and then until you and the client get at some healthy, like, safe point for delivery. Can you talk me through that?
Yeah, and I think you're on target. So the first step, once somebody comes in and says, "Hey, we have a site selection project," we're gonna sit and talk, and we're gonna start with what the goal is.
Yeah.
What are you trying to accomplish? What is the main purpose of doing this? And then from there, we're going to start to expand that to what do you think success looks like for you? What do you hope to gain out of this, along with the goal? And then we're going to start digging into, more granular around what information do you currently have? What data do you have? What information do you have about the area? What experts do you have? So we can start all getting together and talking and interviewing those people to get more insight. From there, we'll develop, okay, this is a project plan. This is what we hope to do. We're going to take this information. We're going to deliver these pieces and then work with the client to make sure this is what they want. Right? Yeah. Do you want maps? Do you want data? Do you want a full report or just an executive summary?
Yeah.
Do you need us to provide pictures of the area? Like, what is it that your expectations are of that deliverable? From there, we can talk and say, okay, this is what it's going to take to build it, right? So we can come up with some estimates around this is the amount of time and effort what we have to put in to build this, and then see if the client wants to work with us in tandem to build it, or they just want to, hey, go run this thing and ask us when you need data or have a question.
Okay.
So we can do either way, right? Both are comfortable. Love working with clients that have internal expertise to be able to do this stuff. They get to learn as well. So both are good ways, or we can just take it on. We want to do checkpoints throughout the process to say, this is where we're at, this is what we're finding. Do you agree with what we're seeing, and do you agree with the process that we're taking to get there? And explain to them, this is how we got it. This is the important stuff, right? And this is where it's headed. Because we might find something partway through, maybe we're a quarter way through, and we're starting to say, man, this is not working out, right? What you're trying to do may not be possible in the way you're thinking, and help provide consultation to say, you should think about doing it this way and offer other solutions. That happens. We all have big, grandiose ideas, but we're not going to force it. We can only do what is possible. And then we'll go through, we also want to look at from their perspective, how much are they willing to invest, not just for us to do the work, how much are they going to invest in this project going forward? Like, is it going to be, they come back and say, we want to expand to 2 sites. We have to keep cost in mind, right? Are you renting? You're going to buy, you're going to build, to put that in to say, this is what that cost will be to do that. And so we might work with their real estate team to identify these different things. And then bringing all that together, and then we decide, okay, we have to come to an agreement of what those deliverables are. And once we've made delivery, obviously this is what we found, full explanation of what everything means and what our suggestions are. So we're going to provide, this is what we think you should do based on the data, what it says, and then work with them. And we should be setting up ahead of time. Do you want continued support to run further processes, or do you just want the report to move forward? So there's setting expectations at the beginning, during the process, and after the process of what they want to do. Oftentimes these will include delivering software. So if they're going to become like an Alteryx user, which is what I've used to do this, they're going to need continued training so we can enable their users to go through and take what we've built and expand upon it. So we'll train them so they understand how to do it. It might include servers. right? So they can automate some of this stuff, and we can come in and do the implementation with them and make sure they're always up to date and answer all of those questions. So different ways that they can work with us.
I'm actually you brought up something there. Curious about, trying to figure out if I want to go back down this rabbit hole of what so we do a lot of different type of analysis, right? Like one-off, or like here's the suggestion based on the data. Then we do a lot of things like dashboarding, where it's like a live thing that you can look at any point in time. So I guess I'm kind of curious what something like this would look like live, but I imagine something like this is most valuable when it's like here, like an ad hoc thing, because the ever-changing nature of this sort of data. And you might not have direct, like a lot of this, it seems like you're going to have to go harvest, or if you need it from census or local data sets, or I imagine Google, especially for some of the routing stuff and like the traffic things that you talked about earlier. Like this might have to be a process where we extract data for specific analyses. So I guess there wasn't really a question there, but what, sorry, I'm going in a few ways. I'm trying to think of how I want to frame this next thought. If we do an analysis like this, how long are the results good for? I guess answering that question helps figure out like how live this thing needs to be, or how often it needs to be refreshed. Let's say in this exact use case, this is this like something where like this is probably good for the next year or two until other things or people move in or out of spaces, or what?
Yeah, so it depends on the data you're using. So in this case, I used a lot of census-based data. This is a real high-level example of doing this. New census data comes out every 2 years. So I would say that's a good cadence, because the health information, the standard deviations of health, that's going to be re-released as part of the American Community Survey from the census every 2 years. Now, competitive data is probably a bit different. It depends. In these rural areas, that competitive data probably doesn't change as often. But if you're a fast food restaurant looking to move, that data can change radically. And that's something you look at more of a quarterly update to that data set. So depending where your demographics come from, and there's lots of third-party demographic data providers, typically a lot of those are updated quarterly. So you might start to look at that frequency, because you may have made your decisions, right? These are the areas we're going to target. How long is your process from your decision to your build out? And what's your red line date? That date where we can't turn back anymore, right? So I'm building a business. Have you bought the land? Have you paid the construction company? Have you gotten the approvals from the city? Things like that, because that could be 8 months to a year or more, depending, right? So if you're deciding where to put a new data center, that might take 2 years to build that building.
Oh yeah.
So do all these things. If you're building a coffee shop, it might take 2 months. They're building one right down the street from me. Interestingly enough, directly across the street from another drive-through coffee shop. Did they do their analysis? So did they do what kind of analysis did they do to say we can support this? Now, what they did that is very noticeable to me is they are on the main road. They're on the main drag, main street. The other coffee shop is attached to a grocery store with a drive-through and set back 300 yards from the street.
Right.
So is that why? Yeah, is that why they felt that there was a competitive advantage? Now, the other thing I'm noticing about that, and where I bring in traffic, and it makes my mind, because I've done so much of this, makes my mind swirl, is the entrance to that new coffee shop is not on the main road. They don't make turn-ins because there's too much traffic.
Yeah.
So they turn down a side road that drives past the other coffee shop and turn in to go.
Yeah.
So I think it's going to be entirely based on the length of the line, or that you have people that prefer X over Y.
Yeah, that makes sense.
But if there's pretty long lines at that coffee shop, so that might be why they believe there's room for two, right? Population wise. And neither
You're giving
one
me a
of
lot
them
to
are
think
the coffee
about.
shop you're thinking of, by the way.
Well, I know, like, I drink cold brew. That's like the only thing I drink. And yeah, and a very popular coffee shop, it's so hit or miss. I say 1 out of every 5 times it's good, and the other 4 times it tastes super burnt. Or what do they call it? Dark roast. It tastes very dark roast.
I live in a town that's small enough that we don't have one.
Oh, you do? Oh, okay.
Surprisingly, yeah. Now there might be. If this video gets popular, I know there's one coming in.
Yeah, there's still coming in. Yeah. But like I will go. I found one that I like, and there's not even a drive-through. Like I have to go in. You can do it in mobile order, but if I'm going in, I'm going in. So I spend my mornings.
Dark ages.
Yeah. But it's so much better. It's like it's a great coffee shop, and
that's what matters.
Yeah, and back to like what you and I were talking about. Well, okay, we could get that.
That's a great example, Treyson. Of what you just said is a great example. So now you're talking about you have an established base of people. So that is one where they wouldn't be looking to move. They're looking for, where can I find more Treysons? That would be our base. This is where I want to go build.
I don't want to know where there are more Treysons. That sounds pretty terrifying. Keep me away from there.
There's a lot more Scotts than there are Treysons, I feel like, in general. But that's the idea, right? That is how you want to start to do demographic and behavioral analysis is, okay, these are the people. They come in 5 times a week. They're here every morning, 7:30 on their way to work. Do I have a loyalty program where I can find out who that person is? Because if I have their address, I can probably find out a lot of information about the type of person. I'm going to know generally how big their family is, the type of industry they probably work in, how much education they probably have, their likelihood to read a book versus watch a movie, likelihood to get their news off of social media rather than the newspaper, and create this person of what it looks like for their good customer. Now that they know that, let's go find where else people like this are. And say, okay, well, if this is, and obviously it's not just one. They're going to look at this as a group of customers that they see as high revenue generating good customer base on averages. Where else are there a lot of these people? That's my target for that type of shop.
Okay. Killer. I love it. I love this conversation. I think this is actually a pretty good place to stop. Because we are over on time, but Scott, thank you. I'm going to let you go with a fun anecdote because we've been talking about census data and Treysons. You mentioned that there at the end. There's a data set that I work with from the census data that it's how many people were born with a name in a certain year. And there have to be 5 people with that name for it to show up in the list of names in the people born in a year. Well, Treyson, the name Treyson doesn't show up until like 1992 or 1993. And then there's like a quick spike in like the late 90s, and then it teeters down to almost nothing again. But like I was born in 1989, so I was born before this name even shows up on the census. And I met 2 other Treysons in my life. There are not a lot of us, so maybe they are in some town in Minnesota. I have no idea, but
you'll see a big spike in the 70s for Scots and a sharp decline into the mid 80s. And it's almost nothing now. You don't very few Uh,
Yeah.
Very few people, I think, under 40 named Scott anymore. Maybe 35, 40. But it was an incredibly popular name when I was born, which I'm not going to say other than it was in the 70s. So
we should build an app that's like, when was your name popular, and then publish it somewhere and
yeah.
let.
Well, I mentioned I worked at a large cell phone company when I was doing the site selection for cell sites, and at the time the company was around. I think it was over 250,000 people that worked for the company. There was 72 Scott Joneses that worked at the company, so they couldn't even use my middle initial to set up an email. It becomes very confusing.
Yeah. Oh, gee, that's crazy. Oh, right. That's right. That's right. You guys at Alteryx, there was very famous, for those in the circle. We can talk about this forever, but there was Scott Jones, you and Scott Jones, Chief Revenue Officer, and you got a lot of Scott Jones, Chief Revenue Officer calls
And
because you were there
emails.
first. Yeah. Emails because you were there first.
Even before he was at Alteryx, I got emails from him when he was, because he was previously at Tableau.
Oh,
right. And then I worked at a company where he was CEO, so I wasn't the original anymore. So he got the good email, and they had to make something that they actually did a lot of analysis and discussion around my email address to absolutely make sure I would never get an email that was meant for him.
That makes sense, because sensitive information might go to him. Exactly. It's also interesting in the world we live in. So,
yes.
All right, Scott, thank you very much for chatting with me, and we'll have to do this again. Oh, I'm sure we will do this again. Yes. You have a great day, man. Again, if you want to reach out to us asking questions about this, or if you want to know more about how we can help you doing site selection or other geospatial analytics or analytics in general, contact information's down. My name's Treyson at DeMarConsultingGroup.com. That was Scott at DeMarConsultingGroup.com. We'd be more than happy to help walk you through this, or follow up, or just chat with you. Have a great day.